All right. Good morning, everyone. It's Coffee and Politics Online with Sydney Walker. And we are scratching the surface today with women's health and issues. And today I am joined with Dannah McKeller Ntaka. And she was supposed to come on earlier, and the hurricane hit
Yes.
one of your areas that you service. So we rescheduled, and it actually turned out perfect with this
Excellent.
being Breast Cancer Awareness Month with talking about women's health issues. And had a great conversation before we started today where this is going to become a series. So look for her face to be a regular, because this access to getting care and just being supportive of each other, but also our loved ones being supportive of us with making sure that we get what we need, because we're the pillars of our families and our communities.
That's right.
So thank you so much for coming on. I'm
Yes.
so happy to hear you, have you on. So tell us more about the services that you offer and the clinics that you service us so we
Very
can
good.
get good care.
Excellent. Again, it is a delight to be here. Thank you, Sydney, for inviting us, and also Dee Holman, who introduced us.
Yes,
I grew
yes.
up with Dee in
Oh,
Tyler,
did you?
Texas.
Oh,
Yes, we
right.
went to the same church. Our families go way back.
Okay,
So there's a
yes.
connection there.
Great family, yes.
Yes. I work at the intersection of pelvic health and viruses like Zika that affect the unborn fetus
Okay.
and the human papillomavirus, which is one virus that causes cervical
Cervical
cancer.
cancer, yes.
As a maternal health researcher for over 2.5 decades, I have studied hundreds of women, whether it's been in the medical schools and hospitals where I've worked, and for the past 20 years at my own research center, where our
Okay.
headquarters is now here in Dallas, and our original
Congrats.
office in
Thank you.
Philadelphia, which is where I left Texas to go to school to be educated.
Okay.
Met my husband, started my family there.
All right. Well,
Yes.
thank you for the service that you've been, doing for us.
Thank you.
So, with your research, just kind of talk about your focus area,
Okay.
and then kind of tell us, what are things that you've seen?
Yes. I'd like to always start with my motivation and where I got started.
Sure. Yes.
My mother is a retired OBGYN nurse practitioner, and my father is a minister, retired minister in East Texas. And when I was 8 years old, I learned about the Tuskegee experiment.
Oh, yes.
And I was traumatized. I was always that kitty scientist that was growing mold under my bed. And I said to my mom, they don't have enough penicillin to help black people. So I was about the age of this little girl right here. And I said, I really need to step up my game. I need to grow more penicillin.
Right.
So being traumatized, the next thing that I did was to make sure that I would be the black person in the room when people were being studied, and there would not be any unethical activity because I would be
So
there. And
important.
people, so at
Yes.
8 years old, I knew about representation some way, somehow.
Right. Right. Oh, gosh. That is a great, unfortunate time in our history, but a catalyst
Yes.
for you to say, not on my watch.
That's right. Not on my watch, because though it happened in Alabama, we're a couple of states over.
Yes.
Black ministers and churches were used to lure black people in. Black nurses were used. So I took that personally.
Yes.
And so here we are
Yes.
today.
Yes. And making sure that we're empowered to seek out the help that we need, and making sure that we're accessing the proper resources and clinicians. So
Yes.
I do want to jump into, especially for black women, we have major problems with, having heavier periods.
Yes.
Anemia is very common with us, and fibroids.
Yes.
And a lot of us have suffered silently
Right.
with dealing with the pain. And people are, just kind of look at you like, well, just take some Tylenol for it. And it's not that simple.
That's right.
So, kind of walk us through when we say fibroid, what is that?
A fibroid tumor is a non-cancerous growth. It's a
Okay.
non-cancerous tumor. And they are common in that they occur in between 70 and 80% of women in their lifetimes will experience a fibroid tumor.
That high.
That high.
Gosh.
Now, our talk is going to be somewhat from the textbook
Okay.
and then somewhat from a scientific Pan-African point of view.
Sure.
I married a gentleman from South Africa. I came from a group of freedom fighters in East Texas, so I was always the rebel in the classroom and in the lab, the quiet rebel, the soft-spoken rebel,
The good troublemaker.
the good troublemaker, but being black is a risk factor. I'm not buying that. So let's go deeper.
Thank you.
It's
Please.
racism, not race. So why do black women have more incidence of fibroid tumors? We really don't know why.
Okay.
But I didn't buy that. That's what the textbook says. We really
Right.
don't know why. So now let's look at this. Estrogen is like fertilizer for
Okay.
a fibroid tumor. And we are supposed to menstruate for 40 years.
Yes.
Pregnancy actually gives us some relief
Yes,
from
it does.
estrogen as well as the other hormone, progesterone.
Okay.
But I'm still not buying. We don't understand why. So let's go back to when you're in elementary or junior high school.
Okay.
And you don't want to get your silk press messed up. And so you get your mom to get you a note to say, I can't do PE.
Right.
Remember those days?
Right. Yes.
So adipose tissue is the scientific word
Okay.
for fat.
Yes.
Estrogen is made in adipose tissue and it likes to live there.
Okay.
So if we are heavier, if we are not exercising, if our food choices are not the best, heavy meat eaters have more incidence of fibroid tumors. So some of this is about a lifestyle change. So those of us who are rebels said, let's look a little deeper.
Okay.
So I'm not blaming the victim. I'm simply saying
Pointing out.
the social determinants of health is another area of expertise for me with the master's in public health, focusing on maternal and child wellness. Foods that are better for us are more expensive. So
Yes.
when you look at systemic racism and how the finances, we have never been paid any reparations. Look at the numbers from a public health standpoint on who has health care,
Right.
access to health care, and who does not. Look
And
at the
just-
neighborhoods.
Right. The access to grocery stores and the ones that are typically serving poorer communities
Right.
don't have the best quality foods in them. But I want to circle back to a point that you brought up with
Okay.
the adipose tissue
Yes.
and being fat or having high body fat
Right.
and lifestyle. And I will say I was the skinny fat girl
Okay.
where high body fat percentage, but I was thin
Right.
and I still developed a fibroid.
Okay. And I'm a
And-
skinny mini, and I still developed fibroids.
Right. So the estrogen that is utopia for the adipose tissue. It is a condominium in heaven for
We love
estrogen.
it. Right. We love it here.
So, talk about how that really supports any dysregulation, because I'm assuming with having the higher body fat percentage and knowing that that's an estrogen
It's a haven.
haven for it, what that does for us.
Okay, I want to go back to the gym, the playground, and the silk press.
Yes.
Sunshine. People who have fibroid tumors have low levels of vitamin D. Vitamin D we get from the sun, and we also get it from fortified foods. Remember when the milk cartons, back when we used to drink milk before we became vegan, vitamin D was in
Fortified.
orange juice, it was in the milk. People who have fibroid tumors, their vitamin D levels are about 23.3 nanograms per milliliter, and that's just of blood. That's a scientific measurement that we use.
Okay.
Normal people have 30 nanograms per milliliter of
Okay.
blood. So we are falling way below. Night workers. I worked
Yes.
25 years,
Yes.
night shift in hospitals and medical schools, running labs, studying conditions
And
like
you're
this.
asleep during the day when
And I'm
you
asleep
should,
during the day.
when you should be getting. You know what?
That's right. But I set my alarm clock because I have this information, and I
Right.
got up. To this day, I take my walk, rain, hail, sleet, or snow, at high noon in the Texas heat, wherever I am.
And we are told to avoid being out in the sun like that, and also using sunscreen, which blocks
The
our
vitamin D.
skin's ability to take that UV light and make
Right.
vitamin D.
So it's a two-edged sword because we do need the sunscreen, but there needs to be times where I do, this is my regimen, 3 times a week with sunscreen, 1 time I go out without.
Right.
Do you understand what I
get
mean?
that
so that we can
balance.
get that balance. Skin cancer is still real for black
Yes, it
people.
is. Yes, it is.
And the darker the pigmentation,
The more sun exposure you need.
yes, because we have a hard time processing and synthesizing the vitamin D. So you can eat things like canned fish, salmon, mackerel, sardines.
Yes.
I know a lot of people are vegan, but eggs, everything that you pretty much have for breakfast has a high
Yes.
content of vitamin D.
Yes, yes, it does. And I will definitely say, being a vegetarian for as long as I have been, because my daughter's 20, almost 20 now,
Okay.
it was a challenge trying to find a vegan D3 source.
Right.
And I want to, because a former registered dietitian here, so when our body is processing the UV light, it goes from D2 to D3. And so with a supplement form, you just want to just bypass all of that and just go for straight D3, because we've also become more indoors
Yes,
with
we have.
the information age and working remotely. And
Right.
yes,
I
so
work on my back porch a lot.
great to
On-
get
on-
that. Yeah.
yes.
And so, how is that playing a role with estrogen and our fibroids? Because,
It's lifestyle.
okay,
It's some lifestyle adjustments. So, again, I rejected that. I don't understand. The textbook doesn't know why
Right.
black women have greater incidence. We are consuming a lot of meat. We are having lower quality food. We can be heavier. And we know that estrogen loves to live in adipose tissue, and
Right.
estrogen is like fertilizer for a fibroid tumor. I'm having green tea.
Yes.
Green tea is another drink that you can use, and there are ingredients in it that will help to
the phytochemicals.
the phytochemicals that will help reduce fibroid tumors.
Do y'all hear that? We need to get on the green tea bandwagon. Okay.
Yes, and exercise and get some sunshine, and our hair is beautiful.
Right.
Straight, curly. I can also
Natural,
tie it
yes.
back to the idea of beauty and the sacrifices that we are making to be beautiful according to someone else's standards.
Right. Because your natural body is being made to not be enough,
Right.
instead of us just being comfortable and happy in our own skin.
Yes. So that's science, that's social science, that's history.
Right.
My professors didn't really like me, but they said, but we can't fight you.
I had one of those during my internship. Because I went to TWU.
Oh, my
So
mom went to TWU.
the Ireton Jones formula for calculating
That's right.
caloric needs.
Yes.
And so I went to school in South Texas at Kingsville A&I, which is Texas A&M University of Kingsville. And I made the comment, well, did the formula make it down here? Because
Oh, wow.
I'm that girl. But y'all know that. This is
I'm that
nothing
girl
new
too.
to my viewers.
Good for you.
Because, I was looking at how needs were being calculated for ventilator patients and, TPN. TPN is when you're being fed through your veins, and we want to make sure we're getting the balance right and not
That's
blow your
right.
veins up,
That's
and
right.
getting those minerals and electrolytes correct so we don't have rocks in it. Such an education. And I questioned a lot of things when it came to what was in the textbook.
I did too. Because we know that there have been some falsehoods printed
Yes.
in textbook.
Yes. Okay, so back to these fibroids. So we know that lifestyle has a huge influence in making sure that we're getting vitamin D and D3 specifically. And I tell everyone that yes, it's a fat soluble vitamin, meaning that your body absorbs it when you have fat calories with it, but also it's a hormone precursor to a lot of our hormones that we make.
Right.
So, yes, get your sunshine vitamin.
That's right.
So now I have fibroids.
Okay.
And let's say, I'm not experiencing anything, so I don't know they're there. My doctor is not checking for anything. And then all of a sudden one day during, I'm looking to, have a babe, and I'm going in for my sonogram, and they see them as part of doing the check on the baby and making sure it doesn't have cleft palate and spinal
Right.
bifida, all that great stuff. Now I find out I have them.
Okay.
So what do we do now with that information?
What are the options? There are some old school options, and because of research, there are many new options. Lifestyle change we just mentioned rather. Uterine artery embolization
Okay.
is when you go in and clamp off the blood supply.
Okay.
Everything needs blood to grow.
Yes.
So then the surgeons are going to clamp off the access of blood to
That's
that
feeding
fibroid.
that tumor.
And it's
Okay.
going to shrink and reduce in size.
Okay.
There's a interventional radiologists have gotten in because they have a specific interest in imaging. So the nurse practitioner, the midwife, the gynecologist is going to have ultrasound in the office. That's
Okay.
traditional.
Okay.
The interventional radiologist is going to go right to the MRI and get a deeper picture. So let's talk about
Yes.
what the fibroid tumors actually look like. So here, this upside down glass is a representation of the uterus.
Okay.
So, and there you can look at your picture. You're going to have fibroid tumors that are going to be here, and depending upon where they are, that's where the symptoms are going to be. So
Okay.
here, going to have fibroid tumors there all around the outside, and they're going to be pushing against the bladder if they're on the front. They're going to be pushing against the rectum if they're on the back, causing constipation. And then
And painful poops.
and painful poop, painful periods.
I'm sorry, I didn't use the
excessive bleeding. That's okay.
clinical word for defecation.
Defecation. Mm-hmm. If I can get them up in here. They're even going to be in there with the baby.
Okay. And we
Pressing.
can see that from the diagram here.
Yes.
Yes, that is.
So in the tissue, in the myometrium, that's going to be the
Okay.
intramural. And they aren't really going to touch any of the exterior membranes. Here, they tend to extend upward. They can even come outside and wrap around the fallopian tubes and stop the sperm from being able to get out and have your
Okay, so
fetus
like
to
this
implant.
one here, that's on the outside.
Yes.
Oh, wow.
So
I
it
did
is
not know
so
that.
incredibly interesting that once they're removed, they're brought to the lab. We slice them paper thin. We look at them under the microscope because we want to know, well, the public says why.
Right.
But in science, we say, what is the mechanism of? There are other growth factor, beta growth factors, that when those numbers are out of order, people have excess fibroid tumors.
Okay.
So we are working, and other scientists are working day and night to work on all of the issues that are below the belt for the woman. And then there are other groups that work on issues below the belt for men too. But fertility it can be an issue.
Okay, yeah. So, first example was, hey, yeah, I'm pregnant, having the ultrasound, and we discover them. So,
Right.
let's say I am not in that journey portion of my life, and I have historically just, since being and hitting my menarche age, heavy periods, painful periods, constantly feeling tired, run down, and finally get to the doctor, and it's like, this has been going on too long. Like, what are my options?
So there are lots of resources. There's in Atlanta, the Atlanta Fibroid Center. Out on YouTube, there is a nurse who calls herself the Fibroid Queen. So
Okay.
we have access to so much more. But ask your clinician about uterine artery embolization. Hysterectomy, one of the older techniques, that is sterilization and permanence. If you have the fibroids that are deeply embedded into the uterus, you can have a myomectomy, the term ectomy, X, the suffix that means removal of. But if you have 10 or 15, see, in the clinic you can see maybe 4 or 5
Okay.
with your ultrasound. But when the interventional radiologists get involved, you might have 15. So it's
Oh,
going to be
gosh.
very difficult to go in and surgically remove all of those and still have an intact uterus. From a clinical anatomy point of view,
Okay.
when we are dissecting a human after their death, and we can actually see, without even looking at the chart, the anatomic representation is there. You can see the tears in the uterus. You can see pretty much a story that's being told.
Oh my gosh. So it's not just this little pea in the pod that grows and everything still functions normally, because I'm sure some people think, well, it's just a fibroid. It's just
Right.
a fibroid. And it's sounding like it's so much more complex than that.
It is, and it's an individual situation where every woman is different. Your 2 may look different than my 3. They can range from the size of a grape all the way up to the size of a grapefruit,
Okay. Okay. Gosh. And so
or a
it's,
small turkey, a small hen at Thanksgiving time.
yes. So before we get to the place of, you know, we have the diagnosis, we know that you have the fibroids. So I'm presenting, gosh, back in my old world, presenting with, the heavy bleeding, the long periods. And I'm seeing my gynecologist. And I'm just kind of getting, and I don't want to say palliative care, but I'm just being prescribed, anti-inflammatories, or something to just dull the pain, because it's not going to get rid of it, or they're telling me to get on birth control to lighten my periods, because I know, because I'm a circa of some older decades here, and I remember an aunt, she had painful periods, and the doctor told her back then, and I think she was like 16 or 17,
Okay.
that her periods would get easier if she had a baby.
Okay.
Why are you telling this 16, 17-year-old girl, go have a kid so you can alleviate your problem with your periods?
Let's even go back to the 1800s when medicine was really just for men. And Dr. J. Marion Sims, quote unquote, the founder of modern gynecology, studied certain conditions, surgical anomalies on the backs of black slave women.
Okay.
Who ethically, from a clinical research point of view, if you are a slave, you can't say, oh, no, I don't want to participate in that research today. So women, even today, we are still working to get more women involved in clinical trials
Yes.
and more black women and men involved in clinical trials, because we are still being affected by the mistrust of the system from the
Yes.
Tuskegee experiment.
Yes.
So back to, what do you do now that you have fibroids? As far as a heavy period, what is a heavy period?
Right.
If you are using a super tampon and a pad, 2 pads, 3 pads, rubber
Changing
sheets,
almost every, hour, 2 hours.
anything, if you're changing more than every 3 to 4 hours, is heavy. If you're afraid to sit on your girlfriend's sofa, if you have to sit on newspaper, that is cause for concern. So just putting definition to what is
Okay,
normal
yeah.
today and what is not. That's what we
Okay.
didn't have in the
Right.
60s, the 70s, and
Okay.
the 80s.
Yes.
That we do have now.
Okay. So it just sounds like, we have definitely grown, but there's still issues that we're having with,
Yes.
you're coming in to talk to your clinician and you're discussing the symptoms that you're having, and it's just kind of like you're being blown off,
Right.
or it feels like you're being blown off because you're being minimized on you don't
Yes.
feel well, there's something wrong, and that plays a huge part in our mental and social
Yes.
well-being. So talk about how our health issues play into how we're treating ourselves,
Yes.
how we're interacting with other people.
That's right. Knowledge is power, as we've heard people say, but it's actually the application of the knowledge that gives us the power.
Okay.
We have lots of organizations. Black Mamas Matter. We have for Kyra. Um, I'm not sure if you know Judge Hatchett,
No.
television judge.
Okay.
Her son's wife passed away in childbirth. There's so much, it all circles back on the women's health spectrum.
Okay.
You're having painful periods, you're having heavy bleeding, you're anemic, you're getting possibly an unnecessary hysterectomy. We have the highest maternal mortality rates.
Yes.
Black women, I can remember when I was a child, what did the older people say? If America has a cold, then Black America has the flu.
Yes.
So it's that type of situation with
Okay.
our reproductive systems. So getting involved with your local OBGYN, asking them some poignant questions, being an educated and informed patient at the campus of care.
So
We have
advocating for
advocating
yourself.
for yourself, keeping a journal. I have my Professor McKellar's bio diary where we have diagrams and you can say exactly where it hurts. But take a science class. We can no longer have people to say, oh, I'm not good at science or I'm not good at math.
Right. Because
When
your life is dependent on it.
your anatomy is with you forever.
Yes.
And we invented many of these systems, so we can't use these as an excuse. So take a science class, learn more about your body,
Right.
and be able to effectively communicate with your clinician.
Okay. I mean, that is very important in lifestyle being such a huge key and factor because, I was a personal trainer when personal training was like new and up
Oh,
and
wow.
coming. And it was, I remember being part of a Facebook and then quite a few people that I've met and have had on the show where we met in a Facebook group called Black Women Work Out.
I'm a part of that group.
Yes, because in the 80s and 90s, it was, I didn't want to mess up my hair.
That's right.
I didn't want to break my nails. And, there was heavy criticism, especially for Black women who may not have been close to the size that we've been idolized to believe is perfect. That they wanted a fit guy, but they weren't fit themselves. And now the Black women are in these gyms. They own the
Yes.
Pelotons.
Yes.
BGM, Black Girl Magic. They are working out. They are sweating. We figure out ways to maintain our hair. It's
That's
like
right.
because now we're understanding what just exercise in general provides so much mentally for
That's right.
us.
The
Not just-
endorphins.
yes.
That's right.
Giving
the happy
you-
hormones.
Giving you mental clarity, just taking time and space for yourself.
That's right.
That is a big thing. So, with lifestyle, if you're just tuning in, we're talking about, women's health. And this is a great conversation that I am having with you. I mean, this is
Thank you.
great. So, with lifestyle and pointing out, low vitamin D levels, adipose tissue being a haven for estrogen, how is that impacting our cardiovascular system and our heart health? And I want to do that in two parts where I'm childbearing age.
Okay.
I have the estrogen on board. And then I'm on the back nine. Flo doesn't visit me anymore.
Okay.
And I thought I was going to be happy because menopause is no joke.
Okay. All right.
So, how does that impact our heart health? So, I'm childbearing. I have all the estrogen on board, but still focusing on improving my lifestyle, because even though estrogen is heart protective,
Right.
it can still go wrong if we have too much. Or
Absolutely.
yes,
Estrogen is a carcinogen. That means it is a cancer-causing agent, and we have an onslaught of it for 40 long years. The average age of menarche, that's the start of your menstrual period, is 13. We know
yes,
that there are outliers. People are starting earlier, they're
yes.
starting later. And then the average age of the onset of menopause is 52 and a half. And the definition for menopause is 12 months consecutively without your menstrual cycle. So when you're in your reproductive years, talk with your clinician, your physician assistant, your midwife, your OBGYN, your family practitioner about what exercise is right for you.
Okay.
Let's throw in some complex situations like if you have fibromyalgia, if you
Yes.
have migraine headaches.
Yes.
Each individual needs to, before you just join a Facebook group or you go out and join the group in Philadelphia where we run around the art museum steps like Rocky did in the movie, talk with your doctor and find out what's right for you.
Okay.
And the same thing when you're in your menopausal or postmenopausal days. I can't impress upon us enough the importance of working together on a multidisciplinary team.
Okay.
Have a personal trainer.
Yes.
Invest in yourself.
Yes.
See the therapist. Have great family relationships and great sister and brother relationships where you are in support groups. And just educate yourself. Read. People have said, oh, we don't like to read. If you want to hide something from somebody, put it in a book.
Put it
We
in a
have
book.
to stop that type of anti-us conversation.
And I would also say my elder women did not talk to me very much about having a period and the
Hush, hush.
changes that
Taboo.
come along with it. And, we're taught to hide it
Right.
because you don't want anyone to know. And then once I started going into the change and being perimenopausal, I was like, y'all forgot to tell me. Like, I knew hot flashes and mood swings,
Right.
but I'm like, y'all didn't tell me about cold flashes,
Right.
because the hot flashes, and please correct me if I'm saying it incorrectly, the hot flashes come because your body is not able to regulate your temperature, so you'll get the burst of heat,
Right.
and then you'll get a burst of coldness because it's like, oh, I'm too hot now. Let me cool off, and the brain fog,
The brain fog. Yes.
insomnia.
Yes, all of that. But they also don't tell you about the wonderful aspects of it. Once you can get through that, and there are hormone replacement therapy, again, talk with your physician about that. There are some contraindications there
Okay.
with people who may already have a heart problem.
Okay.
But on the other side of menopause, you have this burst of energy, and you see women going for second and third careers. There are some, even your noise levels. We are not able to tolerate as much noise.
Jesus on my face because I'm like, where is that burst of energy? Come on.
It's coming.
This time around, and I'm a Pelotoner, so all my Pelotoners out there, I have dialed back my training because I have found that my energy is not there like it was during my first year
Okay.
of menopause.
Okay.
And second year of menopause, I was like, okay, yeah, I'm getting into the swing of the changes.
Right.
And now year 3, I'm like, ooh, I'm struggle bus sometimes.
And then they don't talk about when you have a hysterectomy and then you are thrown into the
Yes.
surgical version of menopause. So, again, talk, have an open dialogue with your husband, your significant other, your partner, your physician. Let's not be shy about it anymore.
Yeah, and so I have a daughter, so I'm telling her, just her monthly changes, just from skin to mood.
Right.
And it's okay, it's part of nature and what happens, but talk about it. If you're not feeling up, you're not your perky self, don't, isolate yourself or bark at people because we don't understand what's going on.
Right.
And I would say one other thing that came about with menopause was heightened anxiety.
Yes.
So,
Meditating, yoga, whatever activity you need to do to regulate your emotions. I journal. I have journaled since I was 6 years old.
okay,
So different things work for different people, but that network, whether you're joining a support group with four other, there's been some studies that have been done in medical schools, and they say, oh, the Asian kids, they do so well with math and science.
right.
The studies revealed that the reason that they do well is because of group planning, group studying, group economics, the same thing that we talk about with Kwanzaa, doing things in a group. It's almost like no child left behind,
Yes.
no woman left behind,
No woman
no
left.
girl
Yes.
left behind.
Oh, wow. This is so interesting. But I do want to get more into that risk factor for having a heart attack, having the stroke,
Yes,
once you're not in walking advertisement for estrogen.
right.
And what happens there, and why the shift?
Yes. And let's circle back to cardiology.
Okay.
I was always taught that cardiologists run the hospital. They have a lot of power, and they're in charge of a lot of things. There is now a marriage between cardiology and gynecology,
Oh.
and it's called cardiogynecology. So when you have people coming from two different schools of thought, pelvic experts coming together with cardiac experts, and that research is really bringing forth a lot of new information.
Great. Oh my
See a
gosh. So
cardiologist.
we're
Many
not
of
in
the
silos anymore.
right. That multidisciplinary team, that collaborating together is really working.
Okay. So what are the cardiologists learning from our pelvic focused practitioners?
I'll give you one example, and that is with the women who are dying in
Yes.
childbirth. Uh, in Britain, there was a study. They studied all of the Olympians.
Yes.
And the Olympic people are working out 50 to 60 hours per week.
Yes.
But when a mother is pregnant, the mother does not get any time off, and the heart has much more volume of blood. And
Because it's
it-
supporting two people.
That's right. So when you think about going into childbirth and you have seizures and other complications that can happen, the school of thought used to be, well, when the placenta is removed, that it's gone. There's no more problems. But what we have found through research is that the women who were having problems in childbirth with their heart issues and preeclampsia and their pre-diabetic states, after their childbearing years were over, they were circling back and seeing more heart issues. So again, see a cardiologist, ask your gynecologist, and because the gynecologist can serve as your primary care physician. Talk about cardiology, especially with us as Black people. We love the great soul food meals.
Yes.
The soul food meals, again, everything goes back.
I'm sorry. Yeah. I'm having a moment here.
take your
No,
time.
no. Go ahead. Go ahead.
It was about love. We were
Yes.
given the scraps of food on the plantation,
Yes.
and Big
And
Mama and
making
them
the-
could
making
make
the
it
best out
taste
of it.
so good.
Yes.
A couple of hundred years later, do we still have to have the fat back?
No.
We don't.
No.
That's right.
Yeah.
And you're going to hear people say, oh, my great granny lived to be 96 years old. Well, she was raising her own hogs. What's in
She
the meat
controlled
today?
the food. Yes.
She grew
Yes.
her own.
Yes.
So, lifestyle and connecting the dots. I really am a big dot connector.
Okay.
'Cause
Yeah.
The way my brain works, it just,
Yes.
I have insomnia. So I'm going to sleep 4 hours really hard, and then the rest of the night I'm going to be up staring
Right,
around. So I have to get up
yes.
and go to the computer and start writing and
Waking up at the witching hour.
yes, putting that data into the spreadsheet so we can have some answers, because I'm just not satisfied with we don't know why. We know why
Right.
if we dig
Yes.
deep enough.
Yes.
There are other scientific reasons that are still being studied, but I can look at some cultural, some socio-cultural reasons that are
Okay.
right here in front of us.
Yes. Okay. So, like I said, I was having a moment, and you could see my face because I'm sitting here saying to myself, okay, so preeclampsia, and I do want you to define the blood pressure level that puts us there.
Yes. So your normal blood pressures, anything that is under 140 on your top number, under 80 to 90 on your lower number.
Okay.
When you go into preeclampsia, you have this skyrocketing blood pressure that can lead to seizures and death.
Okay.
And it's really a touch and go situation. I have a colleague over in Britain who has isolated a biochemical marker for women who have preeclampsia. So again, in deep science, if we dig deep enough, you look at 5,000 blood samples, you're searching under the microscope and looking. There are answers there that we don't know yet, but through funding, and funding is really political,
Yes.
in that you have diseases that get more money
Yes.
than others. And I
It
get
seems
told,
to be the ones that men get.
and I get told all the time, you guys are so loud when you're talking about the maternal mortality rate. Well, the numbers are loud. Any mathematician knows that 20% is a large number. If 1 in 5 black women are dying in childbirth,
Well, I
that's a
mean,
large
seeing
number.
that we're losing body autonomy, if you want women to become birthers, then you want to make sure that they're having good health
Correct.
outcomes for healthy pregnancies. But I want to go back to the blood pressure
Yes.
thing, because not everyone is the 120 over 80.
That's right.
And your norm can be, for a long time, mine was 90 over 60.
Right.
And
For
that
you.
was my number. And when I became pregnant with my second child, I was 130 over 85, 90. And my doctor is like, well, you're not in the preeclampsia range. And I said, but this is high for me. This is very
Right.
high for me.
Right.
And I had swelling in my feet and just overall exhaustion all the time. And my stress level was incredibly high during that pregnancy. And so, being a clinician, I'm speaking up and
Yes.
saying, hey, 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 hey. Okay, now fast forward, I have high blood pressure and I'm on medication for it. And listening to you say there are markers that can show that, and I'm saying, did I have my own version of preeclampsia, but I didn't meet the definition of it?
That's right. That is very possible. And you being an informed clinician, the informed patient, you know your body. Now, if we can get clinicians to listen to the patient,
Yes.
that is an area that we're working on in clinical research. We call it a patient-first focus.
Okay.
So that even at the level of seeking a cure, getting our funding, we are at the street level knocking on doors and saying to patients, we're going to be studying this disease. What are
Right.
your thoughts on it?
Right.
We want more patients to be involved.
Right. Oh,
So that
gosh.
we get more participation once we get the money, because
Yes.
we ask them in the planning phases.
Okay. So, gosh, I mean, and with that kind of history, once you get into postmenopause and you lose the protection, the protective factors that estrogen does have for cardiovascular health, I'm sitting here saying to myself, what does my future look like?
Talk with your physician about hormone replacement therapy and how that works for you.
Really? So
Yes.
I could possibly still be a candidate for that.
Yes, that's something that you and your clinician would look at together based upon you knowing your body and your physician knowing what the standards are nationally and globally.
Okay. Okay. So this is really informative with, and I get real life examples. I get people that reach out to me. I have conversations with community members, and that drives topics
Yes.
for my show. And this is, gosh, that's being a former practitioner myself. I'm saying I see how I have slipped through cracks.
Yes.
And I know the language and the
And the protocols, you know, the workflow.
yes, and I know the
Yes.
abbreviations and the PRN and the S with the line over and the C with the line. I know that, the jargon, all of those things. And I'm sitting here saying to myself,
You still slip through the cracks.
yes.
Yes.
Or people, clinicians will say, oh, well, you're training for a half marathon, you're this and that, you're healthy, and take less concern
Yes.
about my health or someone in that boat with their health. So what kind of, and I know that you said talk to your physician, but when you feel like you're still not being heard, what do you do?
Okay. And this is not a shameless plug for you to purchase our journal, but you can get a dollar store journal and you can say, today is Saturday and I took my blood pressure. If you have a $700 handbag, you can go to CVS and you can get a $99 blood pressure monitor. That's like a little wrist watch
Yeah,
that
I
you can
mean,
wear.
they don't
Apple,
even always cost that much. You can,
right, you can get a cheaper one, but I just want to give the example of what we will spend money
focus
on.
in the, yes, purchases that
Fashion
really
as opposed to fitness and
lifestyle
physical health.
impacting,
Right.
yes.
So with our company, we are a research institute. We are a treasure trove, a warehouse full of knowledge. You can come to us for classes, but our real bread and butter, we're built on 5 pillars right now. We continue to add more pillars, but our number one pillar is specialized home care for women of all ages. With some research studies, after menopause, you're no longer viable. We are studying women 15, 20, 30 years, 90 years old. 15 years out from your menopausal years, we still want to know what's going on because we are technically rewriting some textbooks with our data. So with our
Yes.
home care services, we are following women. We're giving you the charts. We're providing you with these diagnostic tools so that you can take it into your physician because clinicians like data. So when you come in and you say, here's 30 days worth of information, they can say, oh, okay, I got it. I see. Does that make sense?
It does.
Okay.
It does. I mean,
You
yes.
are the driver in your own health.
So I want you guys to really understand that, because even as someone who made a career in the healthcare industry, and me having this dialogue with you, and I'm sitting here saying, wait, because I go in and have my yearly well visit, and my physician has never talked to me about hormone replacement therapy.
Okay. And that's a great conversation to have.
Yeah, because I didn't think that that was something that I could do.
Even down to many of the new therapies tend to be best kept secrets. Uterine artery embolization, a new drug called PrEP. Women over 50 are in the leading numbers with HIV.
Yes.
For me, it's a song that I'm hearing over and over that we don't know about it. So we
Right.
are sounding the bell as clinical researchers and public health professionals to make sure that the general public knows what is available. It's my job to take our 15-page research article and break it down to bite-sized chunks that the public would be interested in. We don't want to put anybody to sleep
Right,
with the
right,
hardcore
right,
science.
right, yeah.
But it's so important.
Gosh, I mean, please come back. I mean,
I
just
want to come back on a regular basis.
tell
'Cause
me.
This excites me.
Yes, tell me when, and I would just block the date. Permanent, just if you want to dump
Wonderful.
monthly, quarterly, however you want to do it. That
Great.
is women focused health topic. It just
Excellent.
Yes, because this is so important. And again, we're not talking to each other
Right.
about things. And, we miss out on just understanding the changes that we go through because it's like, shh, nobody needs to know all about that. And, how do you deal with, and again, I want to go back to it impacts your social and mental well being.
Right.
And then here, you could be at risk for having a stroke or a heart attack because, other factors were there
If we can talk about the heart attack and the stroke, we mentioned we got around in the circle with
Yes.
so many interesting facts. Stress. You
Yes.
hear people say, manage your stress.
What does that mean?
I am a part of the club that says, eliminate as much of it as you can.
Right. Yes.
And that is a painful topic for us because we are in the church, and the church is going to say, God doesn't like divorce. Now, here the preacher's daughter going to get in trouble now. But if you are in a marriage that is creating havoc and your blood pressure is consistently, let's not manage stress. Let us eliminate some forms of stress. We know there are
Right.
some things that we can't
Control.
eliminate.
Right.
You can't choose your parents. You can't choose your genetics. But there are some things we can control.
But
Where
we
stress.
can-
If you
yes.
have a job that when you drive up to the parking lot, you feel like you're going to have a panic attack. Like, get
Or
the
you're
resumes
sitting
going.
there contemplating your life and taking a page out of Thelma and Louise, and you just want to drive off into the sunset.
Yes. Identify your stressors.
Yes. And identify the things that, you can control, because it's one thing. And again, I bring up my relationship with my daughter and talking to her about dating and saying, if he does not serve you, move on.
Right.
And again, as black women, we get caught up in, we want to have the marriage and, have the man. And we have been so socialized, and it is nothing unique to black women, but we've been so socialized that our identity comes from marriage, that we end up being in toxic marriages and relationships to say we have a man.
And we can trace some of that back to the motherland.
Okay.
Even today, by the time you're 35, you need to be married and with children. I have some really interesting and old school views about marriage. I do
Yes.
not believe it is for everyone.
Exactly.
It's a ministry, and if you don't want to serve someone else and they don't want to serve you, let's
Word,
not
you
waste a
doing
bunch
it.
of money
Let's
and
not
cause
have
a bunch of heart attacks.
have a pretty wedding for the sake of having a pretty wedding.
Right.
Yeah. And I know there is a growing movement where we as women are putting more focus on ourselves and learning to say no,
Yes.
because that's very important in eliminating stress and recognizing that you don't have to serve everyone and sacrifice yourself
Yes.
for everyone else.
Yes. Place you first sometimes.
Yeah, because you can't serve anyone else if you're falling apart.
Serve from a full cup. Serve from your overflow. We are so accustomed to serving from
And empty.
our emptiness, our
Yes.
brokenness.
Yes. And
Let's
that,
invest in ourselves.
and that plays a role in our health. And stress can kill you.
Yes.
And I don't think people really realize that. We get so caught up in making the correct food choices that we're not addressing what we're consuming that's not through our mouth. It's
Through your mind.
through your mind.
And the strong woman syndrome. That's a stressor.
I've told people to stop telling me I'm a strong individual, because it became a bumper sticker for I can take it.
Dump your stuff on me.
Yes. And I will say this personal opinion when it comes to, stress and our health. I think that causes us to have so much dysregulation in the body. And there are hormones that come along with stress and
Cortisol, which loves to spend its time around here, the muffin top.
yes,
You can't
and
lose the weight in your belly. Deal with the stress.
deal with stress, and just, looking at where we hold trauma, where we hold
Yes.
stress in our bodies, and how that cascades into we're not making the best food choices, we're not making the best lifestyle choices, we're not doing self-care,
Right.
and it puts us down that pathway to having the benign tumors growing in our bodies, and we textbooks would say we don't know what's causing it, but
Let's dig deeper scientifically.
yeah, let's look at what our information age.
Yes. And support the organizations and the companies who are doing this work,
Yes.
because we face certain types of bias when we get funding. My company teaches people how to go and get funding because we have
great.
experienced the closed doors and the, oh, if you were just a little softer, we could get you some funding. We're going to get the work done no matter what. We built our business credit. We fund ourselves. When there are grants that come down the pike, that's great, but we're not going to go out of business just because someone doesn't have a grant for us to study us as women.
I'm just kind of blown away with be more quiet and we can get you more funding. Closed mouths don't get fed. See, I got some of that East Texas in me too.
That's right.
Closed mouths don't get fed. So, no, we don't need to be quiet. We've been taught and socialized to be quiet,
Right.
to be seen and not heard.
Yes. And you know what people say to me? They say, you've been writing and talking about this since you were in college in the late 80s. Now now it's all over the news and everybody's talking
Yes.
about race-based medicine and the different
Yes.
bias in healthcare. I was talking about this, writing papers about this as a junior at Temple University.
Okay, so one of my former school board members with DISD, I had him on to talk about it. Edwin Flores. Check out the episode on biotechnology.
I saw that yesterday.
Yes. And so, he was talking about the evolution in medicine and compounding medication based on your genetics
Yes.
and doing that precise dosing and targeted delivery,
That's right.
because that's the next stage that
Yes.
we're going to. And I remember having this conversation with my children's father. Used to work at AstraZeneca, and one of the executives there, we were having the conversation about not having enough minorities in clinical research, and it is participating in it to make sure that this drug that you're developing is not this blanket approach
Right.
with dealing with, elevated cholesterol levels or dealing with some mental disturbance where the biochemical reactions in your brain are not where we need them to be.
Right.
And so this is like in the early 2000s.
Okay.
We were having this conversation. So, listening to Edwin talk about it, and grant you, he's a patent attorney.
Okay.
To talk about, patenting these delivery systems and the medication and making that next leap with having AI participating in how we're delivering our therapies.
Yes.
And how great would that be to target fibroids
Yes.
with a targeted delivery system that goes specifically to the tumor and obliterates it?
Right. And there are scientists who are doing that work, who study fibroids only. That's all that they do.
Okay.
They are generalists, and then they are specialists,
Yes.
even
Or-
within research.
And even, looking at our heart health and how that plays a factor and what do we need to do, and is it something that can be done with gene therapy, or, it's just like we're going to a next level where it's beyond the sky.
Yes, bioethics, which is big in
Yes.
public health. And you have people, I'm a part of the religious community, you have people that say, oh, no, we don't want you to be able to edit genes. You even have people who are blind or who are deaf who say, well, if they have children with now CRISPR-Cas9, which was founded by two women, doctor scientists, the deaf people have said, well, we don't want to be able to go in and correct for that and edit that out. So it's like in philosophy, that slippery slope.
Yes.
how much is too much and how much is enough. But the conversation definitely has to be had, and we are
Yes.
having those conversations in the lecture halls and in the
Right.
labs.
But also, you don't want that editing to happen for you. Well, that's your right. That's your
That's
choice.
right, but someone else might.
But somebody else may want that option, and who are you to tell me I shouldn't have that option?
And the real big deal is that if there is a scientist who is extremely biased, are they going to go in and are they going to do something heinous towards people of color? I have told you that I am a wild rebel.
Right.
I reject the terminology minority. I always have. It always made me feel like I was being pinched because we are not the fewest amount of people on the planet. I always thought that term meant something like inferior as opposed to
Yes.
numeric.
Yes.
So
yes.
we are encouraging more and more people of color join the study.
Yes.
But just the pushback with the vaccine, the pushback with when we're calling and knocking on doors and saying, would you come out and try this new drug? We want to find out how it works on black people. So we
Right.
have that data and we
Right.
know what works. We can't do targeted biomedicine if people won't.
If they're not participating. Yes.
Right.
Yes. So, gosh, the biggest takeaway I'm getting from this is one, do your due diligence about your care, because having this conversation with you, as much as I do this for everyone, I still learn and get something out of it, and I'm like ready to schedule my annual
Yes.
and say, okay, we're going to have a bigger conversation here because look,
Wonderful.
not all the boxes are getting checked,
That's right.
but don't look at it as you have to be a former healthcare provider or you have to be a scientist in this. My elder women, my generation, we have to talk to our children who are millennials,
That's right.
Gen Z, Gen Alphas. We have to start having these conversations about what it's going to look like at each stage of your life.
That's right.
So when you go and have your pap smear, you can articulate your needs
Right.
better. Have that journal. I used to
Yay,
have
have
my
your
period
journal.
app, and I would put everything on there from days I was craving something salty
That's
to I just wasn't feeling it.
Right.
And I can't explain why I just wasn't feeling it. And
Right.
then pictures will develop
Yes.
from having that journal.
That's right. I remember when few years back, diagnosed myself with an autoimmune disorder that is extremely rare, that 1 in 50,000 people have. I would get stung by a bee and I'd swell. I'd eat seafood that I had never had any allergic reactions to, and I'd swell. So from 2 years of me tracking that data, I went and laid it on the immunologist's desk and I said, this is what I have. And they said, yes, this is what you have, and you're so rare, you don't fit into any of the 7 categories. There may need to be an 8th category for you.
Wow. But they
The
took you
data really
seriously.
matters.
Yeah.
Right.
Because you had
The data.
on paper that
Graphs.
they couldn't refute.
Yes. So we have to do this for ourselves as patients, as clinicians. And outside of that, I'm not going to say that it's going to be impossible to be listened to, but again, clinicians like data.
Right. They do. Okay.
More so than emotional appeals.
That is so true. So have the evidence there to present to them.
Yes.
So thank you for rescheduling with me and having
Thank
this.
you.
I mean, because we literally scratched the surface.
Yes.
So please,
There's so
let
much
me,
more.
Yes, please let me know.
We've got
when
crates
you-
and crates
yes.
of articles and pictures and things that are interesting to us that may not be interesting to the public, but that the public really needs.
Yes.
The bottom
yes.
line.
We need to have this more conversations like this. So thank you again for coming
you.
on. Yes. Oh my gosh. This has been a breath of welcome knowledge. So I hope that it serves you all as much as it has served myself with having a practitioner here just saying, hey, this is what we have to do for ourselves, because yes, you can fall through the cracks, but let's minimize that as much as possible and arm yourself with having this information about
Yes.
your health.
Absolutely.
Yes, 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 yes. So again, yes, just let me know when you want to come back. Graphs, charts, we can have them
Love it.
edited into the videos, and we can
Beautiful.
just have that discussion. So, guys, we are coming to the conclusion of the show, and it's just so fantastic about the work that you do. And I
Thank you so
appreciate
much.
that.
We
Yeah.
get excited and we run to work.
Yes.
Many hours, double shifts, 16 and 17 hours.
Yes.
This is what we eat, drink, breathe, and sleep
Thank you
about.
for doing that.
Thank you.
Yes.
Thank
So-
you for having us.
Yes. So, guys, make sure that, spend time with the ones that you love, have those meaningful conversations about health. Nothing should be taboo when it comes
right.
to, talking to your family about things. But next week, we'll have a discussion about the Railroad Commissioner. So, former Railroad Commissioner Michael Johnson will be on to discuss, what that office does for us, because we're coming up to an election. And I keep telling you over and over again, elections have consequences.
Yes,
So,
they do.
yes, we want to make sure that we have politicians, officials that are serving us and getting us the things that we need. And DC, our federal government, holds a lot of power and a lot of money that we can have directed into research,
Yes.
cures, therapies that serve us. So
That's
don't
right.
forget that. So until next week.